Thank you very much, and good afternoon, everyone. It's a pleasure to be here on behalf of the American Public Health Association and talk to you about the public health perspective. For those of you who are not familiar with the American Public Health Association, we're the oldest and largest and most diverse organization of public health professionals in the world. We've been around approximately 140 years and count roughly 30,000 among our membership. APHA aims to protect all Americans, families, and communities from serious preventable health threats and strives to assure that community-based health promotion and disease prevention activities and services are universally accessible in the United States. So obviously, antibiotic resistance is a major public health concern for us. Since our founding, APHA has been very active in these types of issues. Dating back to 1893, we worked with New York City to begin America's first campaign to control tuberculosis. In the 1950s, Jonas Salk was one of our members, and we worked to introduce the polio vaccine. And in modern day, we continue to champion these issues. So I'm unfortunately going to talk a little bit about what Dr. Sears mentioned, and I always believe the more you hear it, the more that the message is sent. So as we know, antibiotics were introduced over 70 years ago, and they have saved millions of lives and transformed modern medicine. Thanks to these drugs, individuals with formerly life-threatening bacterial infections can now be treated, and risky medical procedures, as Dr. Sears mentioned, such as surgery, chemotherapy, and transplants are also now made possible. But over the last couple of decades, hospitals and other healthcare institutions have reported more infections that are not treatable by standard therapies. Almost every type of bacteria has become stronger and less responsive to antibiotic resistance. And increasingly, antibiotic resistance is leading to higher treatment costs, longer hospital stays, and unnecessary death and morbidity. The public health implications of this are clear. Antibiotic resistance go far beyond the immediate threat of an individual infection, and when these infections linger, they risk affecting communities, and developing more severe illnesses or transmitting those infections to others is greatly increased. Antibiotic resistance can quickly spread and threaten communities with new strains of infectious disease that are more difficult to cure and more expensive to treat. In fact, according to the Interagency Task Force on Antimicrobial Resistance, antibiotic resistance bacteria could make previously treatable diseases such as pneumonia, meningitis, and tuberculosis, again, untreatable. And while the rising rates of antibiotic resistance is clearly becoming a U.S. public health crisis, this trend is widely recognized as a problem worldwide. The World Health Organization considers antibiotic resistance an emerging threat to global stability. Compounding this issue is the overuse and misuse of antibiotics in food animal production. Antibiotic use in animal agriculture constitutes the overwhelming majority of medically important antibiotic sales in the United States, and as the CDC and others have noted, lead to the greater prevalence of antibiotic resistance pathogens on meat and risks to human health. So as a result, APHA has passed, since dating back to 1999, dozens of scientifically based policy statements addressing this issue. Specifically, APHA advocates for education programs for providers, patients, and the general public about the appropriate use of antibiotics and avoiding the use of antibiotics in the face of viral infections, improved surveillance programs at both the national and local levels to address the geographic variation in resistance patterns, strengthening of state public health department surveillance programs supported by CDC to detect increases in resistance in a timely manner and to actively disseminate the information to healthcare providers, health officials, and policymakers, and the withdrawal of all antibiotics given to healthy animals for economic reasons when these same antibiotics are also used for humans. Most recently, APHA has worked with CDC, the Pew Charitable Trust, and other national organizations to send a letter to members of the Senate Health Committee urging the inclusion of provisions to preserve the efficacy of antibiotics vital to protecting public health, and we will continue to be supportive of efforts to make reporting information publicly available. We've also signed letters to President Obama in support of FDA actions to reduce the overuse and misuse of antibiotics in food animal production, and to the House Energy and Commerce Committee leadership encouraging the DATA Act be included in part of the final ADUFA. Finally, we concur with Dr. Sears that new forms of antibiotics must be made available if we are to effectively deal with emerging resistance problems. APH supports the development of new antibiotics to treat life-threatening illnesses, knowledge sharing on how to use antibiotics, and a mutual commitment to improving use, programs and interventions that help ensure patients get the right antibiotics at the right time for the right duration, and rapid diagnostics to better diagnose infections and their resistance characteristics. In closing, one of the greatest medical advances of the last century is at risk of being lost. We all have a collective responsibility to protect the effectiveness of antibiotics, both those we have today and those that have yet to be developed. The development of resistance is an inevitable byproduct of exposure to antibiotics. However, the American public needs assurances that these essential medicines will be effective in protecting communities and families well into the future. Thank you.
Thank you for that presentation. Are there any questions at the moment? Dr. Peterson.
I wonder if you could talk a little bit about how you see integrating long-term care and acute care together, because we're clearly in this antibiotic resistance boat together, and how do we really deal with each other in that area?
Well, APHA, as I said, is a membership organization, so all of our policy statements are crafted by our members. We do not have a formal policy on that issue at this point, but it's obviously a critical issue for us that needs to be addressed. I think probably my colleague may be able to speak more to you in terms of the long-term care, because APHA deals with more of it from a preventive perspective, but certainly we desire to work collaboratively with our clinical partners.
Yeah, why don't we actually we'll return to that during the open discussion, and maybe have some other panelists address. And I have one more question for you, because you mentioned specifically urging FDA to maybe take some actions that it might be able to take under its own authority to address some of these issues. Can you be a little more specific on what the agency might be able to do that it's not now or not doing enough of?
So we signed on to letters with 25 other national organizations urging the reporting language. It's as we know, the FDA has the information, but they're not making it publicly available. So we think that's very important, and for a variety of reasons, not only to clinicians, but also to state and local public health departments, health officials, in helping to address this issue.